Good.
Welcome, everyone. We've got Dr. Rob in the house, and we're going to get right to the questions that we have. The first one I'm going to put in the answer, Dr. Rob, so you can find it because I'm not sure when it came in. I want to make sure you can see it. It says, this question is prompted by my husband's recent near slip and our couple's CSAT asking what concrete steps are currently in place. My husband has been working with a CSAT whose approach is described as not cookie cutter and has focused primarily on attachment work. I have spoken directly with a CSAT. We're about a year and a half into recovery and two early relapses, and there are currently no written or rehearsed relapse prevention steps in place, though those are expected to be addressed in upcoming sessions. From a CSAT perspective, how is a partner safety meant to be protected in the meantime, especially when the CSAT's risk assessment relies on my husband voicing struggles? And is it clinically reasonable for a partner to ask their spouse to consider a different CSAT if the current approach doesn't provide sufficient containment or safety? Thank you for asking this. This kind of stuff happens often. So thank you for voicing it and bringing it to us. And I can imagine how challenging this is. So thanks for being here. So
You mind
Dr. Rob,
starting, Tammy? Because I
wow,
think I have some thoughts about this, but
I have a lot of thoughts about this.
I'm sure you do.
I'm sorry. If this is your first time here, I'm pretty, call them like a season, and I know literally thousands of therapists are, around the world. And, to me, eh, eh, so a couple of things. First of all, if you're only hearing this from your husband, that I want to give that little caveat to everything I'm going to say, because if you're only hearing this from your husband of my CSAT says, rather than you've met with his CSAT and you know that this is what's happening,
Well, they
those
did
can
say
be.
I've spoken directly with the CSAT just to say it. So she has a,
Oh
or he
yes,
should
I
have
have spoken
some
directly with
relationship,
his CSAT.
but
Okay,
just to
thank
say
you.
it, what you're
Yeah,
saying is important, I think.
yes. So this happens, and I always ask that clarifying question because I want to understand that. So um, I think it's really important for the CSAT to have a clear, a clear treatment plan identified of, and know what the goals are,
Hmm, hmm.
and uh, the attachment wounds and everything, that's later work. Like we do online work groups. And guess what? Sex addiction 101 and porn addiction 101 are the foundational ones. That's where you start. And you would have a relapse prevention plan if you do that work group. Like that's how important that stuff is. I always say, well, I don't, it's a quote, an old quote, a failure to plan is planning to fail. So we are addicts. Our natural tendency is going to be go act out. So we have to learn to do things differently. And the attachment wounds, guess what? If I'm poking around in all of that stuff, I'm going to be more triggered. I need to understand and have a framework, but trying to do deeper work often, can be dysregulating. So unless the client has a really solid program, has the structure in place, has their sponsor from 12 step, has done the at this point, has done the 12 step, program, all of the steps, whatever. Like if that's really solid, then we can start looking at, the trauma and the underlying issues and attachment wounds and all of that kind of stuff. There would be moments where along the way where you go, oh, I can see that's an attachment wound. And then, for example, let's do a little bit of work on that just to shore you up. We're going to hold the space, and then we're going to dive deeper in that at another time when you are really, solidly, on a recovery path. But I can't imagine, if I didn't have a plan for how I'm going to do life when life is so confusing and triggering and everything else. I would need to have a plan so that I know when this happens, because it will, when this happens, I'm going to, and I would have my little emergency kit of this is what I'm going to do. I did. I had, this was before cell phones and like, I knew who to call. I knew I'd get in a car and drive to, my sponsor's house. I mean, I would do whatever I needed to do, go to a meeting, I would, so that I wouldn't be at risk for those things. So, but to your question, I'll turn over to Dr. Rob. I think it's fair for partners to ask. But it could also be this is not helping me feel safe. I am not able to build trust when this is happening. I'm wondering, maybe it's not from a, I need you to do this, but from, I'm wondering if, this person has brought you this far. I wonder if somebody else, could help you. A flip side of it is there are ways he can get all of those things if outside, like 12 step, our online work group. I'll put the link in the sex addiction 101 starts this week. He could join that. He would have a 3 circle plan by the time he left, the 6 week course. So it depends, but I hear you being uncomfortable with the path. I also am wondering if you're working with somebody and
Right.
and you said there's a couples therapist involved in all of this. So now with a couples therapist, the coupleship is the client, and neither of you. But it would be fair to say, I'm feeling like there isn't the opportunity to build trust because there doesn't feel like there's a stable enough foundation, on which to do so. And then you can explore options for how you could create that. So that's my 2 cents. I'm going to pull the work group stuff.
There's so much here.
Yeah.
So I'm just going to go through it piece by piece. The concrete steps piece. So if your husband was depressed, and you said to the therapist, what are the next steps? I think it'd be reasonable to say, well, we're going to work together, see how it goes. We're going to try medication, whatever that is. And then while you're at home, I'd like you to look for this. So if you had, God forbid you had cancer, what are the next steps? Well, you do this and this and this. I don't think that the doctor would say, why do you want to know this? Or this is their personal journey. You don't get to know about it. And I think a lot of, I'm going to go to the clients now. We do hide behind, well, it's my therapy and you don't get to know what's going on there. You want to know everything and you can't. This is my one private place. And well, but not if you're slipping. And maybe that's not even it. You're on this journey too. And you have a right to know and understand how it affects you. It's part of your life. And I think it absolutely, you have a right to know. What I was struck by, I have a whole bunch of things on here, is, sorry, pressing the right buttons here. You said a CSAT, and by the way, for those of you who don't know what a CSAT is, they are certified sex addiction therapists. These are people who've had specific training in the treatment of families and addicts and partners of sex addiction, because it is a specialty. You want to see someone who is trained, who does have expertise. But as Tammy would tell you, not everybody who has this knowledge necessarily does the work in a way that is, let's say, structured and organized. And I was really struck by whose approach is described as not cookie cutter. Well, sometimes you need a cookie cutter, and part of the training, and this is a really sequential kind of work. Tammy just said it, attachment issues are really about deep therapy and looking at my relationships in the past and how they're reflected in the relationships in the present. And that can be very anxiety producing. One of the reasons, there's a reason the cookies are cut with a cookie cutter. And if I start talking to you about deep and meaningful issues from the past, which I think is extremely relevant and important, but you don't have sobriety, well, this is going to raise your anxiety. I never knew this when I became a therapist. It's our job in some ways to raise your anxiety, to make you push forward and look at things that you may not have been able to look before. But in the beginning, it's to keep you stable. It's to make sure, in fact, in my work, I don't really talk about this a lot, but when I used to have an outpatient person come in, someone who's coming for therapy, and I watched them very carefully, because when I was saying, where have you been and where did you go and did you go to meetings? And well, they weren't ready to do anything else. When they started to say things to me like, my sponsor said, or when I was working on this, or the person I met in group, and I would say, okay, they're beginning to do that for themselves. They're beginning to take responsibility and recognize the issues for themselves. I can move away from that. I can begin to explore deeper things and other things because they are now managing their own. But I'll tell you what, if they start talking about slipping and not going, I'm right back into. So I don't think it's, for me, I think we have this thing about follow the patient. And so I need to be where you are. And if you're depressed, I'm going to want to understand your depression and what's going on. And, I'm not going to move you away from them. I'm going to talk about it. If you're slipping or you're struggling, we're going to focus on that. So I might be great attachment wounds therapist. We're going to go right back to, how could we talk about anything else if you're destroying your marriage? What else matters? Well, I'm really deeply in touch with my past, but I had 3 slips and I got arrested. What matters? Because it's all in front of you is the behavior. So, I am concerned when I hear cookie cutter, like that's a bad thing to be, because any of you make cookies, well, my husband says, I tell you what, I won't say that. I'm learning how to cook. And I'm one of those folks, I'm an addict, right? I'm, let's throw some of this in, let's throw some of that. It might be taste, and it never tastes good. And my husband said, follow the recipe. You're not ready to just literally, he's like, you're not ready to try other things. You need to just follow the recipe. And of course, I'm an addict. I'm like, well, let's do this or that. I need to learn the basics of how to cut bread, well, I mean bread pudding, how to make some kind of sauce, and then I might be able to experiment. So basically, I think what Tammy and I are saying is your husband's not ready. And so it's not the therapist's job, I don't think, to choose a method that they want to work in and say, well, this is what I do. And so you'll have to fit into how I work. It's our job to fit into where you're working and what you need. So my job as a therapist is to say, oops, they're slipping. Let's go back and look at that. So I'm a little concerned. Cookie cutter to me sounds a little rigid. Like, this is the way I work. And listen, God bless this person. If they want to work in attachment rooms, there are so many people who need to work on that. But it's not where you start with addiction. And so just to some other things. One thing that sounds really good to me is that you know. And I'm curious how you know, because at least if it's true, he's coming forward and saying, you know what, I'm struggling, I had a slip. That to me would mean not that he's taking responsibility for the behavior or no, but at least he's being honest. And honesty is, I think a lot of spouses or many of you will say, I just want to know what's going on. I just want to know what's happened. I just want to know what is going on. And I think if you do start to get those pieces, even though it may not be going the way you want it to, at least you're not surprised or you're not being gaslighted that what you feel is accurate. Our field is deeply invested in the last 10 years in partners work. I wrote a book about it, maybe two. I completely understand where I don't completely understand, but I have an understanding of your anxiety, of your fears, of where you're coming from. And I incorporate that into the therapy I'm doing with your partner. So if I hear that he's not doing this, he's not doing that, and I've really read and understood, and I'm not coming in and just being anxious or demanding, but I really am concerned. And by the way, you don't sound like someone who's just, this isn't the right word, but just reacting. You sound like someone who is logically saying, this is my understanding and it's not happening. And just the fact it's not happening worries me. I wouldn't feel safe as a partner unless they're doing the things that I understand is best for them. So, risk assessment, blah, blah, blah. Is it clinically responsible for a partner to ask their spouse to consider a different CSAT? So, that is a tough one, because that is where it is not, if this person is providing me a meaningful stability and support, and it is working for me. I had a therapist say to me once, I don't want to be your addiction specialist. I don't want to be your addiction. I've been doing this for many, many years. But when I would struggle, he'd say, go to your sponsor, go talk to someone else. And so, but the result is the same. Sorry, I'm talking a lot. The result is the same, which he should be able, your spouse, he, she, I don't know, should be able to come to you and say, I met with my sponsor and here are the steps I'm working on for relapse prevention. This is, as Tammy said, this is who I call. Or even more important, we do this in treatment. A lot of the guys say, oh, I just acted out. Well, you didn't just act out. You thought about this, you thought about that, and you dropped by here, and you got online. And I think it's very important for us to understand when we're on that road, because at a certain point, well, how about a mountain? When you're rolling downhill, at a certain point, you can't stop. So incorporating the idea that it has to happen in therapy, not necessarily, but the idea that there needs to be something concrete and clear and you feel comfortable with it. I've had guys say, well, my spouse doesn't need to see my circle plan. I'm like, yeah, they do. They need to understand. And why? I want you to be safe. I love you. I want you to be safe. Now, if you're asking something completely unreasonable, or whatever that is, I might say, can you back off a little bit? I think it's very reasonable for you to say, I want to know the plan. I want to know the paths. I know there's a lot here, Tammy, so excuse me for going on and on, but there's so much that I can say. This is such a tough one. I will agree with Tammy that in some ways we can answer these questions and we can give you feedback, but if you are among other women who are, I'm assuming that you're a woman, who are going through this, they're almost the better people to talk about it with, because you're sitting and they know you a little bit and they've gotten to know you and they have some understanding. And, Tammy and I can only give general direction, but I do think you have a reason to be concerned. I don't know if it's a situation where you should ask for someone else or not, but I think that's an important thing to ask your husband. I am really concerned. How would you feel if I did this? Or maybe we should just see the couples therapist for a while, because we're out of alignment with what the plan is. So I'm saying a lot of things, but there are a lot of things here. If you have a disease, you don't want to go, excuse me, this is my belief, you don't want to go down to Mexico and do ayahuasca. You want to go to a qualified professional and you want to understand and you can read, oh, this kind of treatment is this, this, and this. We're not treating, it's interesting, and I'll say this and I'll stop. Therapists kind of like, in therapy in general, we're kind of, well, let's look at this and let's look at that. And I think that is our job. Unless someone has a, a behavior problem. They're drinking, they're using, they're hitting someone. That's when I have to say, hold on, let's not talk about all this stuff. Let's go into this because it's ruining your life. So I absolutely believe that you have the right to say I'm uncomfortable, I'm unsafe. And Tammy, I know we're going on about this. Could you say something about boundaries? So I think this is a really good thing is like, because it's kind of like, do I tell him? And I'm thinking, well, maybe it's different. Maybe that isn't quite it. So I'm wondering what your thought is about that. More like, well, how do I take care of myself? I guess
And so yes, I want to. I
it's a great
do think
question.
it's, yeah, no, but it really is, that I'm, it would help me to develop trust if I knew what your relapse prevention plan is, and I have concern that you do not have a plan. And again, the work group starts this week. It's 6 weeks long. He would have a
And
relapse prevention plan,
mhm.
and he could have, I know you can't go back, but like those are great for people, and many therapists actually recommend them. I will also know, like Dr. Rob said, there are lots of therapists. Like I've been meeting with bunches and bunches of them, and some of them go, I'm not that good at the initial stuff. I want to do the deeper work. So they actually, when someone's in crisis and needs to get that relapse prevention plan and work through some of those things, they want them afterwards, so there are therapists that are really great. Let's talk about your trauma. Let's talk about your attachment wounds and all that, but not until you have a really good foundation, for healing and recovery. And that is more of this, step by step. Dr. Rob wrote, Sex Addiction 101. He wrote partner books too, but he wrote Sex Addiction 101. It's very good. You will have a plan, I pulled up the work group stuff and it says you will develop it. You will create an initial plan for establishing sexual sobriety, to start and develop and implement useful tools for
Mhm.
coping with anxiety, loneliness, boredom, shame, and other stressors. Guess what? That's a plan. You will have a plan, and know how to implement those. So it's a really good, So does he have to get another CSAT? Maybe not, but it would be really important to understand, what's triggering those potential, slips and relapses if if he's doing this other work. Is it? I mean, I remember this is a long time ago, Dr. Rob, but somebody was on one of these and they were I'm overloaded when my therapist is trying to dig in on deeper stuff, and your answer was brilliant. It was like, it's okay for you to go, like, I need to slow this down. I need to stabilize here before I go another layer deeper. This is a lifelong journey, so figuring out attachment wounds. Dr. Eddie and Troy Love both are contributors on our platform. Dr. Eddie, inner child. Troy Love, attachment wounds. Guess what? They both talk about go get a foundation before you start digging into these deeper things.
Right.
It really is, get a solid plan. I talk often about, the residential treatment program. It builds a foundation. You're not completely fixed and have nothing else, you're all good. You all of those wounds are taken care of. No, but you have a foundation so that you can start, digging into those things. But it's layers. I've shared this many a time, but one of my attachment wounds, I didn't even know the name of it until like 8 years ago. Well, I've been in recovery for decades. It didn't keep me from being in recovery. It was more information. It didn't change anything other than I have a name for it and I can go, oh, there's that attachment wound coming up, and I can choose to do something. I can name it.
Mhm.
It didn't change anything. So thinking that, well, if I work on the trauma, if I work on the attachment wounds, then I'm going to be all better. No, get the foundation of recovery. have solid support so that you're not, you're not on the verge of relapsing or relapsing, with everything that, comes your way.
I want to add one thing, and this is actually a Tammy. This is a Tammy answer, which I completely. I'm answering for you. I don't hear anything about, he went to 3 meetings this week and that's what they talked about at the meeting. Or, he has a sponsor and they've been working on, I don't know, Tammy, I don't see anything in here
I didn't see
about
anything about that either. And even if it
therapy's
was,
good and great, but
yeah, that's once a week for 50 minutes, and
right.
this is a 24/7 issue. You guys have been at this a year and a half. That's my biggest concern is if you were
Right.
saying, we're 3 months into this, that's a different category, but you guys are a year and a half. You would be seeing things different. And you may, in that Dr. Robbs,
Mhm.
asked, did he come to you and say, by the way, I almost slipped, but then there's the autopsy on the almost slip of like what was going on,
Mhm.
and but again, if you have a it's a 3 circle plan. These are not rocket science. You do circles, you put things in the different circles, you get help on what needs to be in it. But this is just a really foundational thing on, like I read, it helps tools for coping with anxiety, loneliness, boredom, shame. Guess what? Those are the things that are most likely to make us, slip or relapse. We want to have tools and a plan. So I'm advocating for you to take care of yourself. And it is fair for you to say, I am concerned. I would like to move closer to you, but my concern is that this is going to keep happening. And so I'm really looking for you to shore up and have a solid plan, And again, the work group, I put the link in, starts this week. Gosh, what a actionable thing for you to see him choosing to do that. That would be good. If he's not going to 12 step, like steps 4 through 9 are the biggest house cleaning steps. Those help so much. There are so many tools. If he's only seeing a CSAT, particularly one that isn't supporting that solid foundation, you know, the more foundational work, I mean, if you build a house on quicksand, it's going to sink. You build a house on solid rock, you got a really good chance. So,
I have more.
okay,
I'm
keep
so
going.
sorry,
No,
but
no, no. It's a
there's a couple of things,
great
and
topic. So, thanks for sharing it.
well, there's
Yeah.
multiple issues in here. Um, so I'm going to say this respectfully, and I don't know you, and I don't know your circumstances, but the idea of a near slip. Mm, that concerns me, especially if he's working with a therapist who has very sort of limited vision about what recovery might or might not be. And I'm not saying he did or didn't, but even that term near slip just makes me really uncomfortable. And here's the thing, you wouldn't know because if there isn't a structured plan in place, and by the way, structured plan means, if we get to number 8 and you're really struggling, we're going to go back to number 2. And so I wonder about the near slip part. I wanted to say you can connect these therapists. We can, like, if your husband or a partner would say, you know what, I'm willing to put our couples therapist, they seem to have concerns that my therapist doesn't. Why don't we all talk about it? Why don't we sit down? Because it doesn't have to be a secret. And your concerns are being expressed by the person you're both working with if there is an alignment among the therapists. And Tammy and I know this, we have therapists working together. And I get this question all the time, which is, well, this therapist completely works completely differently than I do. And I don't know how to, he's got the husband, she's got so our alignment, if we're not aligned, say it this way, we become your parents. They're saying this and they're saying that. I always knew, by the way, that if mom didn't let me, I could go to dad and he'd say yes.
Mm.
So we're very good at that. So that concerns me. The last thing I wanted to say is, and this is the reason that Tammy and I have been doing this for 5 years. No, 7.
Oh, it's way more than that. Yeah. It's
Um,
uh it's like 8 years, I think.
uh, you mean I had more hair on my head? No,
No.
this is okay. I still didn't have any. Okay, I got a joke about age because I'm going to apply for Medicare this year, which is just a whole different thing. But I didn't think I'd make it this far. But I wrote something down about this. Oh, one of the reasons that Tammy and I do this, and this is very essential to me as a recovering person, a human being, a social worker. I don't believe most people can afford therapy. I don't think most people make it to therapy. If you get something out of this and you don't have the time, the resources, this is why we do it. And we offer, Tammy talked about the paid groups. Of course, we offer that. We offer the residential treatment, but most folks will never get to do that. And I remember saying, Tammy, which was there are more alcoholics who recovered in Alcoholics Anonymous that ever went to therapy. And so the process isn't necessarily tied to therapy. You can do this without therapy, but you can't do the therapy without this. And my heart goes out to you because you should be being heard. And a year and a half is a very long time. So, okay, I think we got that one.
Uh, and we'll go to the next. Any advice for the betrayer and betrayed in the early weeks, months post formal therapeutic disclosure?
Very big question. So why don't we both take it on? Because they're different, by the way. What is the advice for the betrayer? What is the advice to the betrayed? And then there's a couple. So we have to figure out, Tammy, what are they really asking, do you think?
Well, so I'm curious, how did you both think the formal therapeutic disclosure went? And I'm going to make some assumptions that the betrayer prepared the disclosure. The partner has since completed the letter of impact, and then the betrayer has completed the letter of restitution. If all of that, then you really are post formal therapeutic disclosure. If only part one was happening, then the other two parts should be, coming along. I hardly ever use should. I caught myself doing that, but ideally, you would want all three of those. That's what a formal therapeutic disclosure would be. But you need all three parts of it. You did a formal therapeutic disclosure. What are your qualified professionals advising for the two of you? Um, Often this is where a couples therapist, and again, you want a couples therapist who knows this work, is able to step in and help, because now you're at a point where, there has been a foundation set. A formal therapeutic disclosure, isn't, well, now I'll know everything and we'll be safe forever and all of that. We're setting a foundation. It's the opportunity for the betrayer to gather all the information, understand the magnitude of what they've done. It's a really good relapse prevention as part of the process, because it's like I have documents of what all of this is and the harm it has caused. So if you are there and you are feeling stuck, it would be really important for you to talk to your individual therapist, but again, a couples therapist, or a conjoint session is your two therapists and both of you, like you did for formal therapeutic disclosure, and have that conversation of like, here's where we are now, but we're feeling stuck. So it's like there's so much here that it depends, but you went through formal therapeutic disclosure. Your qualified professional should be able to help you, or if there's a specific question of here's where we're stuck. But if there's solid recoveries, you did a formal therapeutic disclosure and the partner has gotten support, then, it usually, if things are going well, you're navigating the space, and being able to move closer to each other, FANOS check-ins, some commitment to recovery, but also commitment to the relationship in whatever way, was agreed upon. So
There's,
thoughts?
again, this is another multi-layer question. So I guess what came up for me is what are your expectations about what should happen? We can give you lots of answers and we will, but what do you hope for? What are you wanting? What do you believe? And honest to goodness, if I were working with you, I would have each of you sit down with a piece of paper and say, here are the things that I'm expecting will happen. Here's the things that aren't happening. I'd like to have sex. I wouldn't like to have sex. I mean, there's many, many things to ask. The other thing is, there's a number of things. The therapist should tell you. It's great for us to answer, but I think it's a very reasonable thing to say to the therapist. They know what you're going through. They know what you've been through. They know what's been set up. I think it's part of our work as much as it is to say, well, you did disclosure. Are you going to drive home together in the same car? It may be fine to go there together, but we really plan this down, part of being the expert, into keeping you safe. And so I would want to say to you, here's what to expect. Here's what you think is going to happen. And I would always, part of that list I would keep that and go to therapy with it and say, I'm expecting this, and is this right? Is this? I mean, we are supposed to be the experts. Um, there is one other thing that I feel that for me is deeply important is I'm less interested in what you're doing with each other, and I'm more interested in what you're doing to support yourself. Because
Good point.
turning to each other at this moment is probably not your best choice. There's so many feelings and so much information and so much fear and mistrust. And for the addict, fear of abandonment, fear that whatever it is. I think this is one of those times, even if you did this with a couples person, where you have to focus on calming yourself, coming to peace with what's happened. Listen, I'm the one who ruined your life. I can't help you. I know you're used to, and this is the hardest part, I think, Tammy, for couples is that, for me, my spouse is the most important person in my universe. And when I come, I love my kids, whatever it is, but this is, they depend on me, but I depend on my spouse. And when I've had a really bad day or a good day, who's the first person I go to? So this is horrifying. This is a nightmare. And you can't turn to each other because there's so many feelings and so much has happened. So this is my answer, which is what plan do each of you have to make sure that you're getting the support that you need so that, by the way, when there are things you need to do, you're not coming at it with, you have come to peace within yourself of what's happened. So I think the expectation for me is how are you getting the support you need to manage? You've just been through a major trauma. How are you going to be in a place where you can begin to move forward? By the way, you may not move forward the same way. You may not move forward in the same rate. That might also be something to expect. Um, but again, this is a great question because my expectation would not lie on what we're going to do. In fact, I would say we're going to stay out of it to some degree because this is so fresh. This is so new. The last thing you need to go home, in my opinion, is so you said number 5. And what about number 6? And wait a minute, you didn't say, and this is a time when you need to sit with what's happened. And I need to sit with what I've done. And you're not in a place to, I'm going to want to reassure you. I'm going to say, oh, it isn't bad. It was just that. I'm minimizing what's happened. You're going to want to say, but you didn't tell me about this part. It's really best to not focus on each other. If you can have a meal together and you can watch TV together and you can play with your family, your kids, whatever, that's what I would expect. That your life outside of this is going on in a way that is tolerable and functional. This will work itself out, but you need some time, and we do betrayed partners groups. There's a betrayed partners intensive weekend that we offer. I think that there are places to go where you can learn more, but what they're going to tell you is the answer to your piece is here. I may slip, I may not, but are you going to be okay for yourself? Yeah. So
So we've shared a whole number of resources. This will be posted on our website. And if you're looking for specific things, TAMI at seekingintegrity.com. We've got so many webinars and I pull the YouTube links and send them. So there's a lot of good resources that talk about all aspects of this. So, okay. So the next one, Dr. Rob, go ahead.
well, I was just going to say that some people we are seeking integrity. You see it above my head. That is the name of the organization, and I would say 70% of it is free. So please do get on there and go on with your spouse. And by the way, I have I think a reasonably good podcast called Sex, Love, and Addiction. And I have people who just listen together as a couple. And I think that can be really helpful. Another free resource, by the way. So I want to go on to more questions, make sure
Okay.
we get.
The next one, I'm betrayed partner, recovery for 8 months, lying for over 31 years and D-Day in 2001. The next one last May. Having trouble with trusting him as he's taken multiple work groups, but looking for accountability and calm connection, not defensive bear. Any feedback on what to expect or ask for? Maybe boundary work? Yes. Nicole, oops, yeah, you've got your name, but I'm not going to. Okay, I'm going to go pull the
This
work group for
person,
betrayed partners. Yeah. Yeah,
what are they
sorry.
asking exactly, Tammy? Can you maybe
Well,
interpret this?
yeah, so, and I see this all the time. It's like, because people go, well, he took your work group, and I was like, what else has he done? Like
Hmm.
that's part of the problem is, he's having trouble with him taking multiple work group. He's taken multiple work groups, but looking for accountability. But you know what? If all he's done is our work groups, those are psychoeducation. They're helpful. You will get information. Many of the guys and the partners and the partner ones, share phone numbers so that they can connect and have accountability. But I will tell everybody those are not enough. If after 8 months, how many 12-step meetings is he going to every week? What step is he working on in the 12 step? We did a webinar on navigating the 12 steps and what real recovery is. Stopping. So here's another analogy. We will, if you compare it to drinking, somebody who just doesn't drink, they call that a dry drunk. You know what? They're as miserable, if not more miserable, than somebody who's drinking. I hear the defensive bear. That feels dry drunk to me. I'm just abstinent. I'm not in any kind of recovery. And you said recovery. Well, real recovery takes 2 to 5 years. And I don't hear him doing enough work. Again, the work groups are lovely, but if he's not getting support, preferably on a daily basis, with his sponsor and everything, this is 30 years, lying for over 31 years. This is a 24/7, probably started before age 10. So this is decades old stuff. And our lovely psychoeducation, 90 minutes a week for 6-week courses are not enough to combat that. And they aren't, so our drop-in groups are helpful. They're not enough. 12-step is great. And if you really lean into that, and do 90 meetings in 90 days or 180 meetings in 90 days or something, you'll start to get a foundation. And those are probably not enough because you're getting a sponsor, working the steps. It isn't about just warming a chair in the meetings. It's about doing the work. So what I hear is he's warmed a seat in some work groups, but he hasn't really taken the actions that all of the work groups share to show you that he's working on changing. So here I'm going to flip it to you, partner. What are you doing to take care of you? Like if I got the defensive bear, I would use Debbie. Debbie McCrae is the queen of healthy boundaries, and she can say a 4-part talking boundary. I would practice that. What I hear, this is where I'm telling myself is the defensive bear is out. I'm going to choose to not engage in that. And I'm going over here and taking care of myself. If you do what you need to do, I'll come back and check in 20 minutes. If you're able to talk in a reasonable way and not be defensive, great. If not, I'm going to hold space. I'm going to stay regulated no matter what defensive bear is doing. I'm going to take care of me. And it's really hard, especially when all of those patterns and you're wondering and whatever. He is showing you with a lot of data, what he's doing and not doing, to have it's always about actions. And I hear minimal action. So I'm going to encourage you to lean into, help for you. We have support sessions. I'm going to put those into. Those can be helpful. Again, they're not. And guess what? Here's what I'm
Guess who
really going to
does some of
recommend.
the support sessions?
I do, but actually, what I'm going to recommend for you guys, an expert consultation with Dr. Rob, because this feels like this is, a pattern that he could continue for a long time yet. Dr. Rob does a one-time 2-hour expert consultation with couples, and he's very good at identifying the issues and giving guidance for moving forward. And I'll be honest, sometimes, the addict partner does not really like Dr. Rob,
Don't
and
always
that's
make friends.
okay. Yeah. It's not about them liking. We're straight shooters. If he's reading the room and this is what he's seeing, it's important for partners to have that verification that the expert is saying, this is what you've got and what do you need to do to choose for safety for you. So,
Well, I do want to respond to that one piece outside of this whole question, which is I often say, I don't care whether you like me or not, but I do want your respect. I want your respect to me as an expert. I want your respect that I'm giving you guidance and supporting you. You don't have to agree, but I've had patients yell at me, scream at me, that is disrespectful. I wanted to go back to, I want to defend your defensive bear for a minute. Very few of the men I've worked with understand how to be empathic, how to be non-defensive. You come at me with a question and I just shut down because I've been shutting down for 20 years. I try to calm you down. I try to do nice things. I just, none of it works. I did write a book about this, and Tammy knows I get 15 cents for every book I sell because the rest goes to the
it's up from
publisher.
12 cents. So,
Well, thank you very much. Yes, they give me a raise. By the way, I'm going to say this just to say it. I think I've sold 53,000 books in my career, which is, maybe one person at a time has got a little bit of help. But in any case, which means you can borrow one from a friend. But I wrote a book called Out of the Doghouse, a relationship saving guide for men caught cheating. And by the way, I said men caught cheating. I didn't just say sex addicts, because I've never met a man yet who understands the depth of the pain and the hurt that a woman goes through when she's been betrayed, what it means to her in terms of home and her heart. And we operate differently. Men think differently. We act differently. And empathy is not our strong point. Well, the reason I mentioned the book, and I think we teach a course in this as well,
I put the
Tammy.
I put the work group link in the chat.
And I say to the guys, fake it till you make it. If you don't know how to be empathic, try doing the things I actually said. Try saying what I heard you say. Or and by the way, I really want to support what Tammy said was, you got to take care of you. And if you're getting this defensive, whatever, I probably wouldn't say, there you go again. Why are you going to I would probably say, this isn't working for me. I need to take some time out. It isn't a punishment, but for you to stand there and deal with that, well, I didn't do this, and why are you bothering me? And I'm working my own recovery. And every time I talk to you, that's disrespectful to you. So, but that doesn't mean I'm going to stop doing it. In fact, you get upset with me, I'm going to escalate. So one thing I might learn is when I get defensive, you go away. And I don't want you to go away. Maybe I'm doing something that's not right. Experience is a good teacher. But I will say very honestly, addicts are very poor at empathy. We're just not good at it. And we don't want to take responsibility for our behavior, no less find a way to listen and to the things you have to say. And we won't tell the truth about, whether we went and bought a hamburger for lunch. You're on a diet, you're not supposed to eat that. Oh, I didn't eat that. Well, there's the hamburger receipt. We don't tell the truth about anything that we're afraid will make you move away, will make you go after us. So I do think you need to take care of yourself. And the answer to this question is what to expect. And what I would do is I would write down, when are the times when I feel like, you're saying this, you're saying that, you're acting in this way. And that's when I need to step away from you. There is no one can make anyone do anything, but you can take care of yourself. And this is an active process. The 12 steps offer a lot of ways. I've been talking a lot about the 10th step lately, Tammy, because I think, and by the way, that is the opportunity to go back and say, you know what? I didn't do that right. And I'm not talking about the big picture. I made a 10th step today, Tammy. Someone's working on her house, and they're banging in the morning. And I just got, I was incensed. I'm trying to sleep. And I went back and I said, you're just doing your job. And, if maybe you could start a little later in the morning, but and I said, the way after this morning, I'm so, so sorry. And of course, people come back, oh, no, it's fine. But I'm not doing it for them. I don't want to repeat my action. I want to make it clear what is okay and not okay for me. And that is the 10th step. It is going over each time where there's a challenge at the end of every day and saying, I don't want to hold on to this. And I don't want you to feel that I'm not aware of it. So, yes, boundary work for you. Lower your expectations. When we stop acting out, we get very angry and very upset, and we often want to blame you. So take care of yourself, and you would be a good person to go to one of the partners retreats, because I think you would really learn about these kind of boundaries. Okay.
So we're going to go, but I got to share. This is a while back, but I had to make the gas station attendant. The pump wasn't working. It was just a hot mess, and I don't even remember what I said, but it was not the kindest thing. It wasn't completely off the wall, but it was not the kindest thing. And I was on my way to a 12-step meeting. I shared at the 12-step meeting and said, and I'm going to stop on the way home and make an amends to this guy. He was floored that he's like, oh, it's okay. I said, no, it is not okay. I did not act within my integrity, and I owe you an amends. And I mean, he was just like looking at me like, because people don't do that, but we have to if we want to be on a different thing. So yeah. So this brings us to the next question, which I love this question. My partner wants to do their 12-step amends. I am reasonably sure they will miss at least one major aspect of loss. Do I have a conversation about this prior so they recognize it and do the work on it, or wait and see if they figure it out and then work on more amends?
I give that one to you to
Okay.
start. I can see you chomping at the bit.
I'm like, okay, so this is not a one and done. When I did my amends, I had the list, and guess what? It was fluid because I would remember more. Or, and it was not like I'm going to run. And so let me finish one thought. I'm trying. I'm sorry.
Breathe.
I know, but I get, okay. So, I had my list and more people would be added to it. But my sponsor was really clear because I was like, how do I, do all of this? And it was like, people will come to you. And they were right. I've shared this before on webinars. I was in a bookstore and all of a sudden there was somebody, I wanted to crawl underneath the bookshelves and like hide. And I was like, nope, you got to go, and I did. I walked up and I made an amends. There was one, it was another in a community center. I kept finding these people in random, public places. And I knew that was the time to make those amends. But for the people, like for the people that were the closest to me, there were a few things of specifics, but the rest of it was about a living amends. So this is different than the
Can
formal
you explain
therapeutic
that, living
disclosure.
amends? Can you say what
Yes,
that
I will.
is?
But this is different than a formal therapeutic disclosure where there's a list of restitution. That's specific, to different things. Like if I took $10,000 out of our family account and did that, then that would be a specific thing, and that would be restitution. But the amends was a living amends is there's nothing I can do that will just, I don't even use sorry. You hear me use amends language, but there's nothing that I can tell you, sorry, sorry, sorry. It is, I need to show you with my actions that I'm on a different path. I can say, I know my behaviors were horrible, and if there's specific things, but I'm working really hard on this today so that I don't continue to go on that path, that I'm moving forward in a different. But if you're looking to catch somebody, like if that's your goal, I'm confident you can. But could it be from a place of I'm this is like unpeeling the onion or whatever, like this comes in layers, and we have more
Mhm.
awarenesses of like, oh, there's that. My list was, like kept getting, oh, there's that person. Oh, there's that incident. So it was really something. And I would invite you to focus on what do you need to do to take care of yourself, and let this person do, a letter of restitution if it's restitution, but the amends is something that is a lot more. It takes more time, it takes more thoughtfulness, and as more is revealed and revealed within us about the impact our behaviors have had. And I could see the temptation for the addict partner to go, I want to get this over with. I did too, but I trusted the sponsor that said, they will come, it's like the field of dreams. If you build it, they will come. I wrote my list, they came. So it's a process. This is not, you know, all done. So
I just want to say something personal that has nothing to, that is only barely related, which is I'm very aware in my life of the people who aren't treated well. I'll just say this, this is a different thing. Do you ever notice how when someone's yelling at the pharmacist? Because what do you mean my insurance doesn't cover? And I called 3 days ago, and what do you mean I have to call the doctor, or at the airline? Well, what do you mean? Well, my ticket, and I try very hard to give meaningful respect to the people who I know are regularly being disrespected. And I just want, that brings me so much joy. Now I do want to go to other people and say, it's not easy for them to sit behind that counter. That's not my job. But I always try to say, your job must be hard for you. I really respect it. I really want to do that extra thing. This is not about you, but it's, you know what? It's a living amends. It's saying I didn't treat a lot of people well when I was in addiction, but I can really do the extra mile because I don't know all those people I wasn't nice to, but I can, and I can't go back and fix it, but I can act in a way that's respectful and gives dignity to, that is dignified with everyone I run into. And that is living amends. I may not be able to come up to you and do it, but I can live in a different way. I did want to answer the question more directly in the way I would think about it, which is, it's sort of what Tammy said, which is um, what I would want from my partner is, some other things may come up, or I might say the conversation wouldn't be, now, are you going to, miss something? Because my question would be, when you realize, and you will, that some things have come up, would you talk about it? Would you come and make amends to it? Would you? And I'll say this just about my own amends. There were some I wasn't ready to make. I just
Mhm.
wasn't. And my sponsor said, well, write them down and put in your nightstand, and there'll come a time when you're ready to make them. So, and they were when I was ready to make them. So, but basically what I'm saying is that it is my responsibility as the addict to do the best I can to the best of my ability. I think it should be your expectation that there will be more, and I will run into other things. And and it isn't your job to say, well, here's another one. It's your job to be hopeful. And if I see them doing the work that Tammy talked about, and if I really see them working the 12 steps, there, you can't escape it. You can't escape being responsible for it is a guide to life, for those of us addicts. It says you need to go back and clean up your, I'm going to say it, you need to go back and clean up your shit. By the way, I don't say that because it's disrespectful to Tammy and she doesn't like it. But I'll
I
say to
use
you
the
folks,
S word all the time. So
serious,
yeah,
that
yeah,
serious,
yeah.
simple. All
Yeah.
right,
Keep going.
let's move on.
Okay. What work can be done daily, long term for a recovering addict? I
Hmm.
love this question too. I mean, like, here's what happens when people don't do daily work, they relapse. So it has always staggered me that when something's really working for someone and they're starting to make progress and their lives are getting better, then they go, oh, I'm going to stop doing all of those things that worked for me. So it's finding the things that do work for you. I love to be of service. That's a big thing in my 12-step recovery, but I still do my meditations every day. I don't go to 12-step meetings every day anymore, but I still go to meetings regularly. I like to go to at least once a week. Twice is better, but it depends on my schedule and what I'm doing. But I do the things that I need to do on a daily basis. That would be a great conversation with your sponsor and your therapist to, but also look at what you're doing that's working. What's going to help you, on that? What's in your outer circle, and it isn't your outer circle would have recovery things in it, but it wouldn't have all recovery things. So what helps you find the balance and, and feel like you're contributing member of society? That's important to me. But I still do the basic things that I did early on. We just talked about the 10 step. We know the 10th, 11th, and 12 steps because we live them. Like those are a daily thing. Those aren't just like, oh, I did the
Imperfectly.
12 step. Yeah, but it isn't like I did the 12 steps, back in the day and I'm all good. No, I do the 10th, 11th, and 12 steps on a daily basis. They're really important. Those are the continuing steps. So doing that. If something's coming up, go do another 4-step on it. Like it's just all of this stuff keeps. I go to meetings and we read stuff. We're reading out of the literature, and there's some of the stuff I've heard. I don't even know how many times, and somebody will say something, or I'll read it and just where I am, and I'll go, oh, so there's always that opportunity to go deeper, and it's pretty amazing. And I'm grateful. So, keep doing what's working, find else you need to do, explore different options for, how you can show up and be of service.
I am. I have a completely different perspective on this
Mm.
question, which is, what if it's a partner who's asking this question? Because then it would
I had
be,
no, it says, oh,
what do I
oh,
need
yeah.
you
Okay.
to
I hear
see
what you
you
said.
doing
I
to make
gotcha.
sure? And I hear you. At first, I was like, oh, an addict and how responsible. And they're asking, how can I get through every day? But I'm also picturing that spouse saying, Dr. Rob said
Great
you're
catch.
supposed to do this, and why aren't you
Yeah.
doing this? And that worries. And so I'll take the other side that may or may not be
Yeah.
true.
Please.
But what are you really asking? What is it, the long-term recovery for them, or is it about your being at peace and you're being comfortable? Will you be able to be reassured that, oh, they're meditating today? Oh, okay, they're doing service. And, I don't know what's right for that person and what they need to do or what they don't need to do. But if this is a partner, I am concerned, I mean, we'll really like this. I'm concerned if you're looking to him or her for your peace of mind. If you wake up in the morning and you say, no, in early recovery, I do expect what I expect you to do what you say you're going to do. That I expect. If you're going to go to a meeting every day, I'm going to therapy, I'm going to meditate, whatever that is. I have an expectation that if you're going to do it, and this is how we talk about how you begin to trust us again as we do the things that we say we're going to do. But that comes from us. It isn't your saying, did you do this? Did you do that? And I say to the spouses, if you find yourself saying, well, did you do this today? Did you do that today? That's not how it's supposed to work. I'm supposed to come to you as an advocate and say, this is what I did today. My job is to make you feel better and reassure you that I'm doing these things. But there's a very consistent through line in this work, and Tammy actually taught me this in many ways, which is an addict's stability, a partner's stability cannot rise and fall on how we are doing. Because we go up, we go down, we have slips, we tell the truth, we lie. I mean, we are troubled people. And if you say, oh, they're having a good day, so I'm okay. Oh, they're back at it again. They're not doing that. And so I'm not okay. I think, and this is the hardest thing in the world, to sit back and say, you know what, I'm going to be okay and do the things that I need to do for me, whether they do or not. And by the way, trust your gut, because it doesn't matter what they're doing. What matters is what are you feeling? What are you seeing? How does it, what does it mean to you? But so Tam, I want to throw that back to you because it is a different perspective to say, because I do hear the spouse say, well, I want to know what they're doing. That's where my head goes. And what about that question? Do you have any other
Well,
thoughts?
if it is, yeah, I would go again, focus on you and really, this is easy. What are you seeing? The actions of the betraying partner that show you that they're, consistent. And if you go, well, they lied for so long, yeah, but that was before, and now they were lying, and your radar is going to be a lot more in tune to picking up on nuances. If they're doing really well, and then all of a sudden you're going like something's wrong, trust your something's wrong, and it's okay for you to go, the story I love the story I'm telling myself. The story I'm telling myself is things feel off. I'm concerned, that you're taking care of yourself. My husband is a brave man, and like
He is.
he is, and he said, I don't even remember what but and he said, would you like to talk about that after you go to a meeting? Just I wanted to lash out, and I went, this man really loves me. I'm going to go to a meeting. He's saying this out of love, and he was able to do that. Now this is this is in long term. We're in a long-term relationship. I'm in long-term recovery, but I still was in that completely dysregulated state, and he was able to step into that. That isn't going to be everybody. You can talk about, like, here's, I see, good things happening for you. I'm curious, what are you hearing at your meetings about, like, what does this mean for the long term? I went to, at least a meeting a day. Actually, I was going to like 10 meetings every week, and that was, but anyway, so I don't do that anymore. So yes, we start to, get in a different place, but it isn't, I completely stepped away from all of the things I need to do. And like I said, I do my meditations in the morning. I do the things that ground me. I stay away from things that are dysregulating. I hardly watch news. I just don't need to
Me
know it.
too.
Yeah, I mean, it's just like anything that's going to make me, I
Dysregulated.
just don't, yeah, I just don't need it. I
It's
work
funny.
hard to stay, in a calm and I fought for serenity. I did not have any of that. And now, like, I cherish it, and I want to do as much as I can to stay in a place where I'm thinking, and I will make amends, and I will try to do it as quickly as possible, but I don't like having to make amends, and because so I will do it to clean up, but if I cannot have to make them, everybody benefits from me not, going off the rails. So that would be most of my response. It's like, you'll see, like, trust you, partner, if that's the way this is written. Trust that you are watching what the actions are, you're gathering data, and you're taking care of you. So you're going to be okay regardless of what that person does or doesn't do.
Um, I have two answers for this. Well, one is about you, and I don't think we should take any more questions tonight. I do
Hmm.
want to stop, and I'll tell you why. Um, I'll tell you one thing that I have some expectation for that's a meaningful part of long-term recovery. We do service. I make sure that every day, and even it's saying to the pharmacist, life must be hard for you right now. I do something every day to try to make someone's life easier or to try to put them at peace. Or there may be something I do on a regular basis, volunteer or something. But I do believe that there is a piece in long-term recovery that says I'm not the most important person in the world, and I am going to make a commitment for the long term to respect and offer something of myself to someone else. In meetings, that happens a lot because I have many opportunities to say, can I, help with this or that? But I do think when I see my someone I'm working with give of themselves, that's when on a regular basis, I think they are doing what they need to be doing. So I want to just say one little thing that's a personal, Tammy. Tomorrow, my husband and I will met 25 years ago. And now, as gay people, we can't say we've been married 25 years because we've only been legal allowed to be married since 2014. But I never thought, I'm not going to get tearful here. I never thought that I could create and that we could share, that I could share with anyone um, what's the word for it? The hope that I get every single day that I can be the person they need to be. And no, that's just a bunch of words. I am so grateful every single day. I don't deserve it after what I've been through and what I did, and I say, what's wrong with you? I've said this a lot. What's wrong with you that you stay with me? What is wrong with you? Anyone in their right mind, this is true, would not want to be with me. You know what he says? I love you. I love you to the bottom of my soul. I love you. And I wouldn't want to be with anyone else. And as Tammy's husband, yeah, I know that's what it is. But that's not the part I worry. That's not the part that upsets me. Other people, by the way, they can't be with me. They look at that and like, oh no, that's not something I can deal with. But he sees past that. And he really sees who I am every single day. So anyway, Tammy, I want to say I'm
So I'm going
so
to intervene
grateful.
on your negative thinking. Like I believe that you do deserve to be in a loving and caring relationship. I do deserve it. I think you deserve to be in a long-term relationship with somebody that you love and loves you. I think we work really hard at becoming better people so that we can show up for our partners. Not perfectly. We do it in a human way. My husband and I, on Groundhog's Day celebrated 35 years together, so
Mm.
so it's really meaningful. And I think, like you, daily how grateful I am that this person is in my life, and and that I get to share life with him. And life is life. We know each other's struggles. We have external things all over the place. And guess what? We still show up for life, with each other. And, that's what a relationship is. And for those that choose this recovery path, I promise if you're willing to stay the course, if you addicts would do the work and make sure that you're staying on track, you can have a really good relationship. Partners will see you going like, what, that person is showing up and doing the work. I'm going to hang in there. I see that the actions are different. I'm going to hope for a better a better tomorrow, and it comes. So my AirPods just died. So
I want to say one more thing, which is I was 40. I'm 65. I was 40 before I was ready to have a meaningful relationship. I was not ready to be respectful, to be introspective, to take responsibility as if I wasn't ready. And I just say that for those of you, and there are many of you who, we're this age and why isn't it going better? Or why am I still alone? Or I've had so many bad relationships. I had to go through all of that to at least have a grasp on what it meant to love someone for the long term. So anyway, 25 years tomorrow, and I'm really, really
congratulations.
thank you.
Yes,
And it is one day at a time.
it
It is
is
one
one day at
day.
a
I
time.
don't
And
expect.
yeah, no, but
So
yeah, if it ended today, I'm grateful for every moment that we've had, and I will cherish that, and and grieve and whatever. But yeah, I mean, we've had health issues and everything else, and we're still standing. So
thanks,
okay, bye
Tammy. Good to
everyone.
see you
Thank
guys.
you.
We will be here. Come visit us, Seeking Integrity.